James Evans.
Diolch Llywyd, and can I thank the Cabinet Minister for his statement today and welcome him to his new role. I'd like to take this opportunity to thank all our NHS staff and health and social care staff across Wales. Health and care is one of the greatest responsibilities any minister can hold, because behind every statistic is a person, a family, and often someone who has waited far too long. You have said, Cabinet Minister, that the system is beset by crisis. You said patients and staff are being failed. You said emergency departments are buckling. You said corridor care is becoming normalised. You said cancer is lagging behind. You said the workforce is stressed and financial pressures are acute. On that assessment, Cabinet Minister, you are right. But here is the problem. You cannot diagnose a crisis and then prescribe another strategy. The people of Wales do not need another speech about renewal. They need treatment, they need appointments, they need operations, they need an ambulance to arrive on time, and they need to see a GP. The Welsh NHS doesn't need any more slogans, it needs delivery. You talked about the spirit of Bevan. Well, Bevan did not build the NHS with a press release or something swanky on social media. He delivered it, and now that is the real test for you. And there are areas where we can agree. We support a health service free at the point of delivery. We support better prevention. We support GP services, faster cancer diagnosis, improved dementia support, proper support for unpaid carers, and a social care system that treats care workers with the respect that they deserve. But warm words will not be enough. Wales has had plans after plans, target after target, and promise after promise. And what patients need now is a government prepared to be judged on results. On waiting lists, you said the immediate priority is to tackle the backlog. You promised that 2-year waits will be eliminated within a matter of months, and the overall backlog will be reduced to pre-pandemic levels before the end of this Senate term. So let us have a straight answer today. How many months? 3, 6, 9? Because within months might sound good in a press release, but it means very little to someone who's waiting in pain at home for their operation. On surgical and diagnostic hubs, I welcome the principle. High-volume elective care hubs can make a real difference in areas such as orthopaedics, ophthalmology and general surgery. But you said an expert group is being convened to develop a delivery plan for TED hubs across 4 years. So where will they be? Where will each one open? Who will staff them? And how will rural patients be able to access them? Because a hub without staff is just a sign on the door. Wales has had enough of announcements that sound big on the day and then disappear into a system never to appear again. On primary and GP care, the Cabinet Minister, I want to put this to you directly because I've sat with you in this chamber, I've sat with you in committee, and I have heard you time and time again call for more support and more funding for primary care. You also backed the Health and Social Care Committee's report in the previous Senate on GP practices in Wales. Now you're no longer asking the questions, you are the person who has to answer them. So will you implement those recommendations in full, yes or no? On social care, you are right. Too many people are stuck in hospital beds because care is not available in the community. That is bad for patients, bad for families, and bad for the NHS. But a national care service must not become another expensive layer of bureaucracy. So will you guarantee today that money will go to frontline care, not more boards, not more structures, and not more administration in Cathays Park? On unpaid carers, Wales does rely on these every single day. They save our public purse billions of pounds. They feel invisible, exhausted and unsupported. And timely carers' needs assessments are welcome, but they must lead to real support, respite, practical advice and emergency help when families need it, and we need that now, not months down the line. On cancer, you admitted Wales is lagging behind. That is a serious admission, and I agree with you. Wales does need a cancer action plan. So I ask you, when will it be published? Is it going to include proper targets for diagnosis, for treatment, for outcomes? Let's have the answer. On workforce, you said a long-term strategy will come in the autumn. Cabinet Minister, autumn is becoming this Welsh Government's waiting room, isn't it? Because everything you want to seem to be doing is going to be done in the autumn. We have staff pressures now. We have graduates worried about jobs. We have vacancies now. And what immediate action are you going to take before the autumn? Because the time is ticking. And on prevention, I agree with you. We cannot keep treating a system that actually waits for people to become seriously ill before acting. Sport, physical activity, reducing obesity, and making sure people stay healthier is very important. So can you outline, Cabinet Secretary, how that money, that's the previous Cabinet Minister, how you're going to make sure money flows? I'll come to the end now, Deputy Presiding Officer, I can see you looking at me. Cabinet Minister, you have the biggest job in government. You have made big promises to the people of Wales, and I'll just tell you, we will be watching, the people of Wales will be watching. You asked for power, now it is your time to deliver. Diolch.